Immunohistochemistry is the localization of antigens or proteins in tissue sections by the use of a labeled antibody as a specific reagent through antigen-antibody interaction that are visualized by a marker such as a fluorescent dye enzyme and a colloidal gold. Albert H. Goons and his colleagues in 1950 were the first to label antibody with a fluorescent dye and use it to identify antigens in tissue section. With the expansion and development of immunohistochemistry technique, enzyme labels have been introduced such as peroxidase, alkaline phosphatase, and colloidal gold. Procedure: Immunohistochemistry tissue is treated with antibody, primary antibody against the sought antigen, a secondary antibody labeled with an indicator, an enzyme which catalyzes a color producing reaction. Example: horseradish peroxidase is then attached to the primary antibody, indicated by a DAB diaminobenzidine, then react with the horseradish peroxidase indicator to give a color product. Immunofluorescence, similar procedure is followed except that a fluorescent tag or fluorophore, fluorescein and rhodomine which produce fluorescence is used to dictate bond antibody. Dictation of bond antibody by either method indirectly confirm the presence of sought antigen. Immunohistochemistry is able to demonstrate any protein including enzyme. Application in forensic pathology. A number of proteins shows increased expression in various traumatic states which are dictated by immunohistochemistry. Beta amyloid precursor protein in axonal injury, ischemic traumatic otherwise, cardiac troponin C10C, cardiac troponin TNT is in acute myocardial damage. Expression of cardiac troponin is strongly positive, diffuse and more frequent than cardiac TNT. Cardiac troponin, troponin C, troponin D. Complement C9 with the myocardium. Complement C9, cardiac troponin, amyloid precursor protein. Complement C9 with the myocardium damaged by ischemia, cellular adhesion molecule, growth factor and proteins in the lungs of patients who die from septicemia induced lung injury. E selectin in endothelium of pulmonary vasculature. ICAM, intracellular adhesion molecule in endothelium and in leukocyte with the lungs. Lactoferrin and VLA4 in pulmonary leukocyte. Lactoferrin and VLA4 in pulmonary leukocyte. Vascular endothelial growth factor VEGF, vascular endothelial growth factor, which is normally strong expressed in a normal alveolar and bronchial epithelium of healthy individuals. It downregulated, decreased. Microtubule associated protein in decreased in hypoxia and ischemia, hanging, drowning, carbon monoxide poisoning. Wound age determination, application in toxicology, heat shock proteins are increased in a number of toxic conditions. This